Welcome to Sassy Mama's fourth virtual expert chat. I'm Kristen, the marketing manager at Sassy Mama, and today I'm here with Dr. Fung from Osler Health International and Natalie Spencer, a registered nurse, midwife, and lactation consultant for mother and child.
Thank you for having us here this morning. And I'm Dr. Fung from Osler Health.
Yeah, I'm Natalie from Mother and Child. And today we're going through pretty much everything, the basics, a flyover view of things you need to know about having a baby here in Singapore, and then all your supports for afterwards, and who to see for help afterwards, because that can be just as steep of a learning curve as your pregnancy can be as well.
So as we sort of go on, you'll see I'm actually a family doctor, a general practitioner to many of you, or GP to many of you, and I'll be taking you through some of the slides. I'm going to make this slightly interactive. You see the slides going between Natalie and myself, and as you said, we're going to take you through sort of the practical aspects of getting through what you're going to need to know when you have a baby.
Yeah.
This is just an overview of what we're going to cover today. Some birthing options, some of the prenatal and postnatal support groups here in Singapore, and we're going to cover aspects of care for your baby, more from the practical aspects, and care for the mothers and fathers as well. Who's who? This is sort of quite fun to know, because you'll be coming across all these various people on the list. So your OBGYN or your obstetrician, the doctor who delivers your baby. We have GPs and family physician, that's who I am, who could help you at the start of your pregnancy journey, and certainly once you have a newborn as well. We know what a pediatrician is, a doctor who looks after babies, and we'll talk about that as well and where they fit in. Midwife, that's who Natalie is, a nurse midwife, and she's also a lactation consultant and a doula. So we're going to help you dissect a little through what various people do and where they fit in, and actually what's available here in Singapore. I think that's sort of the key.
Yeah. Great. So for those of you maybe that are joining us that are not pregnant yet, or maybe you're thinking about having a baby in the near future, or maybe those of you that just found out you're pregnant and you don't know what the next step is, one of the first things you'll have to do earlier on within your first trimester is to find an obstetrician, or otherwise known as your gynae doctor here in Singapore. There's a few steps you can take to try to find the right one, whether that's, chatting to friends that have already had babies, or good old Google. But I think it's really important to assess personally what your requirements are first for your pregnancy. For example, do you have any pre-existing medical conditions, or maybe pregnancy might be a little bit more complex? You need an obstetrician who specializes in more complex pregnancies or those with other medical conditions. Religious requirements I put there only because if you, for some reason, either preference or religion, need a female obstetrician, it's important to know who's out there that can fit your needs as well. So just assess what you would personally require during your pregnancy to make sure that you can align yourself with the right gynae or obstetrician. So then also too, what will determine who you choose will be what kind of setting you like to give birth in, and we'll chat about the different settings in a moment. And then research what the different settings options are in Singapore. We'll talk about which kind of hospital and where those doctors are at. So for example, if you find a hospital that you would like, there are numerous doctors that help to deliver babies within one hospital. So if you are set on one hospital, for example, look at what doctors do deliveries at that hospital, because that might determine who you choose. Or if you're more set on one particular doctor, find out where they do their deliveries, and then you can also choose your hospital from that point. Then probably the last thing too would be get back up to talk to other friends, moms, your family physician. You can come and see us at Mother and Child. We have lots of referrals based on your preferences for what kind of doctor you would like. So yeah, that's in a nutshell how to choose the right obstetrician. So I mentioned a little bit already where to give birth. So there are two main options in terms of where to give birth. The most common is obviously in the hospital, and it would just depend on whether you choose to go private hospital or public government hospital. So you can start to explore those two options. But if you decide to go with a particular obstetrician, it may determine whether you go private or public as well. Or if you have certain insurance that dictates where you need to go, that also is a factor. Home birth does happen in Singapore, but obviously it's less common, and only very few obstetricians will practice home birth in Singapore.
Right. So this is taking you on the journey of what to expect when you discover you're pregnant. Earlier on, Natalie was talking about the care where you can ask, us who's a good obstetrician you can recommend. So certainly the journey can start with your family doctor. As soon as you get that sort of positive pregnancy test, some people do actually come to their doctors, and that's the point where we can recommend perhaps a couple of names of obstetricians you can go to. So there is a scan that you can have at about 6 weeks. It's called the dating scan. That's actually the most accurate way of determining your due date. So it's actually measuring the size of the fetus at that point, which gives you your due date. I normally recommend taking this first appointment at the dating scan at 6 weeks to get to know, or get to know the obstetrician. So you may be going to 1 or 2 or even 3 for the dating scan, and that allows you to decide whether it's an obstetrician you may go with. The very last point on this slide is because it's quite common here in Singapore that they offer antenatal packages, which take you through the whole journey of what you can see on that list. So you may not want to commit to an obstetrician if they're offering a package, because you might change your mind halfway through. So that first appointment could be quite helpful to determine if they're the right fit for you. Moving on, there's then another scan at 10 to 12 weeks. That's your big appointment. That's sort of where you have your full antenatal scans and tests and blood tests and all, perhaps some of the tests that you would have heard of already to determine whether there's any genetic abnormality or any risks involved in that pregnancy. Thereafter, you have a monthly checkup with the obstetrician, and that's usually accompanied by a scan as well. It's quite fun because you actually get a good 3D or a 4D scan, a bit like what's in the picture over there. At 20 weeks, this is an important scan that has to happen. It actually looks in detail at the different structures of the baby's growth. And at 28 weeks, there is a diabetes test. This is actually a fasting glucose test, checking for diabetes in pregnancy. And at 28 and 32 weeks, there are vaccinations to consider for the mums to be. And now there are a few vaccinations to consider, including the COVID vaccine. And thereafter is a checkup every 2 weeks, and then until you're due, and the due date is at 40 weeks, just in case for the people who are, have not gone through pregnancy. So a full pregnancy is classed at 40 weeks. So that's called term. And after term, you will see your doctor weekly. In the last sort of 30 to 40 weeks in the pregnancy, you may be seeing your doctor a little bit more frequently. Some obstetricians may ask you to have an appointment weekly because there may be things that they're monitoring for. So that may change as well. So you can see a very busy time over the sort of 8-9 months where there are lots of visits and tests and scans. This is a chance for you to ask your questions and ask questions about the pregnancy, so you can see why it's useful and important to find an obstetrician that you trust and that fits your needs.
I'll just add something, as I just thought of something too, that you may want to consider to fit into your timeline of checkups. from about 34-ish weeks onwards, if you are thinking about breastfeeding once you give birth, what you can also do is see a lactation consultant, either like myself or my colleagues at Mother and Child, for what we call a pre-lac consult, just to talk a little bit more about what your breastfeeding journey might look like, especially if you have any underlying conditions that you're thinking may affect your breastfeeding, or just to find out more. Or maybe this is your second baby, you've already done classes, you've already been through this, but maybe you want to know a little bit more about breastfeeding, just moving forward with your second child. Anyway, thank you. I just wanted to
add that in.
For those of you that don't know already, having a baby can be quite expensive. So first of all, the bottom line is just to make sure that you have insurance, something that will cover some of the cost, at least for having a baby. Obviously, people have different insurance, so get to know your insurance policy for exactly what it covers. Some insurance won't cover your prenatal checkups, nor your delivery, or your birth rather. But they will only cover if something goes wrong, like a complication. So don't get any, unexpected surprises. Know your policy, know exactly what it will cover, just so that you can be reassured, of things like that, and not get a shock when it comes to getting your hospital bill at the end, or your doctor's bill. This can also be something you include in your research for your different obstetricians or your different hospitals, because costs will vary between obstetricians and hospitals. And you can even, ask them. I have on there that water birth can be just as expensive as getting an epidural at some hospitals. So these are things you can actually itemize and ask at the hospital when you do your tours, or write in an email, because they do have itemized price details for every procedure, for every, everything that they'll use during your hospital stay. So don't be afraid to ask these questions, because it can help you budget and to plan ahead. Lots of different options for giving birth here in Singapore. Maybe I've just put a few different options that some people opt for their birth. Some of them that you may, like a hot topic usually, is water birth. So there are places you can do, if you're interested in water birth, or at least having a bath as a pain relief option in labor. There are certain hospitals that do, so that's definitely an option. You can totally have an unmedicated birth if that's something you would like to plan for. Definitely, all obstetricians would support that. All right. Different pain relief options I've got on there, like laughing gas, epidural. That's all pretty much standard for every hospital. Elective cesarean. So if you can definitely choose to have an elective cesarean and not go through labor. I know in some other countries, if you go through government hospital, you can't necessarily opt for an elective, but here in Singapore, you can, if that's something you would like. Doula support. So maybe if you remember on one of the first slides, one of the people you may come across during your pregnancy, your labor, your birth would be a doula. So a doula is, just for those of you that don't know, it's not a fancy yoga pose or anything like that. This is a trained professional. They're not necessarily medical-based background, but they're a trained professional to support you. They're basically like a professional cheerleader for your labor time and for your birth. So they'll do things like help you cope through labor contractions, educate you before you give birth on labor, on breastfeeding, and then they'll also most likely support you for a few weeks after giving birth as well, such with breastfeeding and just with your general healing and care after giving birth. So this is definitely something you can utilize. To start thinking about it now. There's the Doulas of Singapore registry website. You can go on and there's all the registered doulas there. But just keep in mind with the changing COVID situations that different hospitals have different regulations on if your doula is able to come to the hospital for your labor and birth. So just that's another good question to ask your hospital once you choose one. Other things I've just got on there is, birthing positions. You don't have to give birth on your back. You can give birth in any position. Again, this may be limited. Some of these things, like I have written on there at the bottom, all these options may be limited just to your specific obstetrician, your gynae, maybe any complications or anything that comes up during your labor and then also your hospital facility. So obviously, if your hospital doesn't have a pool or a bath rather, then you can't utilize that. So if these are some options you're looking for, consider that in your research. But just know that you do have options. It's not just one way to give birth here in Singapore. So again, just gonna chat quickly about prenatal class. I would highly recommend, especially if it's your first baby, to take prenatal class. Having a baby is such a steep learning curve. And even with the class, it'll be a learning curve, but why not take the steps to make a foundation in getting to know what childbirth will be like. So meeting labor and actually giving birth, and also your postnatal period. So there's many benefits. One is to make friends with people that are gonna have babies around the same time as you. Again, prenatal class is a great way to get to know what's exactly going to happen, or to allow you, it gives you the information to feel confident to make decisions that you may need to make in regards to your labor, birth, and afterbirth. And in doing that, you'll put your mind at ease. Probably many of you right now, if you're early on in your pregnancy, you've probably got a million questions going through your head about what to expect. So take a prenatal class and get the majority of those questions answered. And not only will prenatal class give you kind of the theory or the information, but also give you a practical component to different positions, physical movements you can do during pregnancy or your labor, your birth. It'll just overall prepare you for the whole experience. And I've got there the aims already I've mentioned, but the bottom line is, like I've said, to empower you to be able to make informed decisions, and then to ask questions to your doctor as well. You don't necessarily have to give birth, as I mentioned, one way. If you feel passionate about certain things in your labor and your birth and your afterbirth that you would like to experience, get to know the information. It's, evidence-based information we give you in the class, and you can feel empowered in being able to make those decisions yourself. And also probably another most important thing I've got on the last is that the aim of the class is to also help you to be able to look at your birth experience as a positive one, no matter what type of birth you have. Again, there's different types of class. There's traditional prenatal class. At Mother and Child, we've got, we call it our childbirth preparation course. And then there's also, maybe some of you have heard about hypnobirthing. Okay, this isn't about hypnotizing yourself during your labor and birth necessarily, but it's just more of a mindful technique about childbirth. So there's two different options. I've got all the topics listed there of what's typically covered in both sorts of classes. Probably the one that everyone always asks is when to go to the hospital. That's a big one, so get that answered. Breastfeeding is a huge topic, and newborn care. All right, and then, sorry, it's a bit heavy on me all of a sudden, but postnatal support, that's a huge one as well. There are lots and lots of supports here in Singapore, so you're never alone. Always seek help as soon as you think you need it. I've got the list there. A big one would be seeing a lactation consultant, like myself, someone who is IBCLC, fancy letters just meaning International Board Certified Lactation Consultant. This is somebody that's done many hours of training and practical experience to specialize just in breastfeeding education and assistance. So as soon as you think, or even if you think it's going okay, just to get reassurance, contact a lactation consultant, such as us at Mother and Child. Another probably huge one would be for any mental health concerns. Baby blues is very normal, postnatal depression more common than we think. So seeing either your family GP, perinatal mental health specialist, women's health physio, huge one. That's something I always recommend to moms, no matter what type of birth you have. And then two, I know Sassy Mama's got the new moms groups, where earlier you could get in touch to form, connections with people that have similar due dates to you. So there are new mother support groups out there. And also we have support groups specifically at Mother and Child for dads as well. All right, that's enough from me.
Right, before we go on, actually, and certainly these postnatal support groups and the prenatal
Mm.
support groups that we're talking about are really very, very helpful. So, as I mentioned right at the beginning, I'm actually a GP, and you can see we sort of feature on this group as well. We've worked very closely with Mother and Child over many years, and actually they've invited us in many of their talks to actually provide a lot of that information that you see on the prenatal page as well as the postnatal support group on this page. What we can offer is that sort of medical advice that transcends across a lot of the different topics that you saw on the previous slides as well, and provide that certainly together with the lactation consultants often provide that sort of medical that information that you need around about breastfeeding, and perhaps, you know, as one breastfeeds and have some issues surrounding that, we can also help with that as well. But I'll talk about sort of where the support we can offer. We've been working very closely with
refer back and forth
to support these groups. So if we go on to the next slide now, you will see many questions thrown and many questions in these bubbles. I'm not here to answer all of them, in fact, any of them, but what we're trying to showcase here is once the baby arrives, you have all these questions, and by no means are these questions exhaustive. So it can range from, of course, breastfeeding. That's the thing we're thinking about, but you know, it could be around swaddling. How do we manage that? Do I need a pacifier? I've heard good things and bad things about that. Is this vomiting normal? You know, what else have I got in there? What temperature should my aircon be? And these might sound like they're sort of practical questions, and who do you ask? And certainly there is a wealth of information out there online and in groups, but what we want to stress is we need to make sure you're getting the right advice. The groups that we work across that were listed there would hopefully be giving you advice that is evidence-based and accurate. Certainly, as a doctor, I see a lot of newborns. These are the sorts of questions I'd be answering in my consultation as well. It is not always, you know, a very medical question, but it is relevant and important as part of looking after your baby. But what we wanted to share and stress on this slide is there are lots and lots of questions you would have. There is lots of information, but do always check to make sure the information and the site that you're getting the information from is accurate. Right. So developmental assessments, and these are visits to your doctor. So what usually happens here in Singapore is your obstetrician, the doctor who's looking after you on the journey of your pregnancy, usually recommends a pediatrician, who is a doctor who looks after children or babies, to be in the room during your delivery. This may be the doctor that you will continue bringing your baby to after the baby is born, but it's actually not always necessary that you stick with that doctor. As GP, I look after babies as well, and so does the rest of my team of doctors that I work with at Osler Health. And you'll see that you'll have quite a lot of visits. So we talked about those visits you have with your obstetrician, and now we've talked about the visits for your baby. So the usual visits, usually about a week after delivering, a month, 2, 4, 6, 9, as you can see, it goes on. These are the routine visits that you almost certainly will have. And all these visits are usually accompanied by babies' vaccinations or injections. There may be extra visits necessary. Maybe we have to, you know, be monitoring the weight, giving you more help with feeding, etc. So there could be extra visits necessary. But what happens in these visits with us, with the doctors, is we're checking the baby's key developmental milestones. So certainly the first couple of weeks and months is a lot centered around sort of feeding, but as they start to become more active and they develop, there are certain milestones that we would like them to achieve, and these are the visits that we are monitoring. The visits with us here, I spend about 30 to 45 minutes with each of the babies I see at these visits, covering all the issues in the previous slides and all the questions that mum could have, and certainly covering the key developmental milestones. And we also signpost you to what to expect before you come back for your next appointment. So what the next milestone might be. It's also an opportunity for you to ask any questions for you, for the baby, that is relevant. So quite often, it could be a question for yourself, but that actually is linked in with how you're caring for your baby. And that is where we as GPs, as a general doctor, general practitioner, able to actually answer all those questions, because some of those issues might be linked. We're not just a doctor for your baby, but we're a doctor, we can look after mums as well. So it's we're sort of in a very unique position to be able to help you with both, because quite a lot of the times these issues overlap. Next slide, please. Right, vaccinations. We've only listed on this slide the vaccinations that baby could have in the first 6 months. But as you saw in my previous slides, vaccinations carry on till about 18 months. What I want to stress here is certainly where I am, we look after a lot of the international population here in Singapore as well. But, and we have the Singapore vaccination schedule to refer to, but vaccinations in essence for anyone, whether you live in Singapore, from Singapore or not, can be tailored to your needs. It can be tailored to your medical needs, your concerns. If you want to spread it out a little bit more, if you don't want the vaccinations to be so close together. Talking about someone who's not from Singapore, we can refer to the vaccination schedule from your home country and make sure we're compliant with that as well. So what we're able to do is able to tailor the vaccination program and not have to rigidly follow the Singapore program for you to make sure, one, that your baby's safe, and two, that you're compliant with the Singapore vaccination needs as well as the needs of perhaps the country you're from. Just one thing I want to stress, which is the top line here, the 2 vaccinations that are offered at birth. You will be offered, or rather your baby will be offered 2 vaccinations whilst you're in hospital before you are discharged from hospital. The hepatitis B vaccination and the BCG, which is against tuberculosis. It is not compulsory that you have these vaccinations, but it's highly recommended. If you decide not to have the hepatitis B, there is absolutely very easy to amalgamate it into further vaccinations in the 5-in-1 and 6-in-1. That's not an issue. The BCG is the one I just want to talk a little bit more about. A lot of you may know the BCG vaccine or may have a little scar on your arm to show for that. It is against tuberculosis. TB is coming back worldwide now, and it's not just a condition here that is, not common. It is actually getting a lot more common. This is a vaccine now that we know that it's most effective if given young, and it's best given under the age of 6 months. And the reason for that is under the age of 6 months, you can actually have the vaccine in the bum, which means, the one that gives the scar, you can hide the scar there. I want to stress that because there have been situations where they're offering you the vaccine in hospital and they give you the vaccination in the arm. And I've had many a times an upset mum or parent come to me and realize that they weren't given that option. So you've heard it here, you've heard it now. If you're offered the BCG, it can be given in the bottom if it's under 6 months. So if you're given that at the hospital, you should have the option. You should have the option there. It is a vaccine that leaves a scar, and it's not because the person who's given the vaccine hasn't done a great job. It is a vaccine that does leave a little scar. Right, caring for mothers. So we talked about sort of your whole antenatal journey, and we want to make sure that you are cared for as well. It's very important that the mothers and the new mums to be, a lot of you out there are well supported. So in the prenatal classes, the postnatal classes, and all the support groups that's out there, that's now widely available here in Singapore, and also the Sassy Mama pregnancy groups that Kristen was introduced there. There is a lot of support for mothers, and it's important that you get the support because there is a lot of information, as we talked about, out there, but it's practical support for you. It's important that you get help for yourself as well. quite often, you are the ones caring for the baby, and there are a lot of well-meaning friends and family who want to help you. But perhaps, ask for help, not so much with the baby, but ask for help with all the other practical aspects of cooking, getting you a meal, cleaning, and make sure you ask for help so that you can focus your attention on yourself and the baby. Don't forget that you need and should get a follow-up from your doctor as well. This is usually offered to you by your obstetrician around about 6 weeks after delivering. Some of these new moms come to us GPs as well, because we're able to offer this care. And as I mentioned before, quite often, some of the needs, for example, contraception and how they're feeling, is tied in with how they're managing and how they're coping with their new baby. So not only are we focusing as doctors on the mom themselves, but also their needs are certainly overlapping with their baby's needs. So we're able to address all of that together in a more certainly wider and a more holistic way. The last thing on there is mental wellness of the mother. We know that baby blues are very common. That's when we just feel a little bit fed up, a little bit down, sometimes a little bit blue, and maybe a little bit depressed. And we say, actually, we know baby blues can occur up to 80% of new moms in the first couple of weeks. And that's because of a whole host of things. This is a new journey, a new experience, and a lot to take on and learn. And we absolutely care about baby, and that can sometimes take a toll. So it's important that we recognize that, you recognize that, and acknowledge that. And often what you need is the practical aspects of getting your questions and worry about feeding, and is my baby putting on weight well, answered. And if that's answered well, that can put your mind at rest as well. So that's been a whirlwind, sort of taking you through the journey of practically what to expect. What we've covered today is your pregnancy birth options, how you choose a doctor, labor, and your birth care. The important thing is arm yourself, educate yourself, get as much information as you need to suit your needs, and think about a prenatal class, as Natalie, mentioned there. There's a lot of information, and that whole, we know about breastfeeding, but actually arm yourself with information about what to expect before you deliver. Use the postnatal support groups that are out there, and tap in on your family doctor, someone who has that sort of overall view, who are able to manage mom and baby. As I mentioned a little bit before, it often is to be able to tie in both your needs and your baby's needs, because they're closely interlinked. And this is something we certainly offer, and hopefully offer that, in the way that we can tailor that to your needs. Okay, I think we've come to the end of our talk here.
Awesome. Thank you so much. This is a great explanation, on what to expect when you are expecting in Singapore. Pregnancy is such an exciting time, but it can be also so overwhelming. So it's so great to have all this information broken down to help put our minds at ease when we're getting ready to welcome baby. We've had some questions coming in already, but as a reminder, if you have something you'd like to ask, please put it in the Zoom chat function, and we will do our best to get to all the questions. The first question is, do you have any intel on the subsidized route in public government hospitals?
That's a tricky one.
Yeah.
That one probably is best to speak to if you are looking for that option. Go to whatever hospital you're considering, talk to their finance department, or just even their, I think it's like customer support. They have all these kind of customer service-based names. Talk to the main desks, or give them a call, and they can take you through each of those options. As a midwife, and here in Singapore, and probably same for Dr. Fung, we're not dealing with all those ins and outs every day. So
most hospitals now, public and private, have they're like business offices.
Yes.
That's what they call them now, and they are amenable to phone calls for you to ask those specific questions. The subsidies can be quite complicated,
Yes.
so but these hospitals have the business office where you can get the information.
Yeah.
Very helpful. This person is asking, this is my second baby. I suffered with low supply last time. Am I likely to have low supply issues again this time? Is there anything I can do to prepare before baby arrives to help?
Yes, so I can answer that. So not necessarily that you'll have the same experience in terms of breastfeeding. Every baby, every pregnancy is so different. So yeah, just because you had that problem last time doesn't mean you'll experience it this time. However, I would recommend considering your history of low milk supply, that you do as what I mentioned earlier and book a pre-lactation consultation with a lactation consultant, so we can kind of go through what exactly happened that maybe caused your low milk supply. There's lots of causes to low milk supply. Usually it's in relation to how baby feeds at the breast, with all the mechanics and ins and out. Other times it can be due to underlying medical conditions or hormone conditions. So book in a pre-lactation consult with us at Mother Child. We can go through all of that and then help you take those steps while you're pregnant, and also right in those first few days and weeks once baby is born, to help you get off on the right start in terms of your milk production.
Yeah, absolutely. I just want to second that, and to say, actually, the first thing to say is it doesn't necessarily, it may not happen again this time. So I think that's the first thing to say, and get that information, get that pre-birth, natal advice is very important. It will help you dissect what happened the last time. And indeed so, what I also wanted to add is there is help if you do have low milk supply.
Yes.
We work actually quite closely with Mother and Child to support women with low milk supply. And sometimes it may indeed be the fact that we have to support and increase the milk supply with medication, but not always. Quite often we can, with the right advice, be able to not have to use the medication, but the help is there. So just engage early and engage with the right support to get the help you need.
Yeah.
Great. That's so reassuring to know you can have a totally different experience the second time around. Our third question is, what are your thoughts on confinement nanny?
Yeah. You want to go? I don't mind.
Yeah, you can.
Okay. I think in a nutshell, they're great. I think a lot of our society these days, we try to be really independent, think we can do everything on our own post giving birth, and many of us don't live with our families or we're far away. So having that built-in in-home support is great for someone to look after food and care and healing, things like that. Obviously there's varying degrees of confinement nanny to how strict they stick to the practices. The one thing I always say to moms with just be if you have a certain, if you have a plan for how you want to feed your baby in terms of breastfeeding, or if it is bottle feeding, just make sure the nanny knows your plan and your goals for your feeds for baby, just because sometimes with a confinement nanny, they can, if you don't have a particular plan, then they'll just kind of do the default, which might mean, letting you rest a bit more and then they feed baby, but they may be covering some of those opportunities for you to either bond with baby or to help your milk supply. Because with breastfeeding, it's a supply-demand process. The more baby feeds and removes milk from the breast, the more milk you produce. So sometimes if the nanny wants to do more of the feeds, and especially in those early days, you might be taking away those opportunities to get your milk off to the right start, your production off to the right start, and for those times to bond with baby. In a nutshell, I think they're great, but yeah, just make sure they know your feeding plan for baby. And also too, a lot of people will have a confinement nanny and then let them do everything in terms of diaper change and bathing. And then the nanny leaves after 6 to 8 weeks. And then they're like, oh my gosh, how do we change a diaper? How do we bathe the baby? So it's great for the nanny to do that early on, but then start to transition, wean off the nanny, as I like to say, about halfway through your time. So that way, by the time she leaves, you can feel totally confident and independent.
Yeah, totally. I think, that slide we're talking about getting the practical help and getting sort of help in for yourself. And I think that's the advantage we've got here in Singapore to have a confinement nanny. And it is so helpful to have someone close by in the home and guiding you through that time. But think so true. Just if you're clear about what you'd like and actually have baby as your priority,
Yes.
with that support, so that we have the right balance between looking after baby, bonding with baby, and absolutely getting the support, advice, information, practical help. And I think it's overall, I think, a positive thing.
Good to know. This next question is, I'm sure, one on a lot of people's mind these days. This person writes, "Hi, I'm 9 weeks pregnant but unvaccinated against COVID. What would you suggest? Would you suggest to take it, and if so, when?"
Right. COVID vaccine.
Yeah.
So absolutely. About a year ago, when the COVID vaccine first came on the market, we can understand why there was a lot more reservation. But with time and hindsight now, we have a lot more data now about the COVID vaccine. We know it's safe to be used in pregnancy, but what I really want to talk about is, firstly, the safety. I think the safety data is very clear with COVID vaccine in pregnancy. The other reason we would certainly suggest taking the COVID vaccine is you will be able to pass the antibodies that you develop from the vaccine onto baby. Baby almost certainly will not be getting their own COVID vaccine anytime soon. And the ability to pass the antibodies onto baby is valuable. You probably saw in one of our slides talking about vaccines, and the whooping cough vaccine has been highly recommended for about the last, I think, 8 to 10 years now. And the whole reason for that is and it's given, you may have noticed, at a certain time frame between 28 to 32 weeks, slightly later on in pregnancy, so that there's enough time to pass the antibodies on at its optimal level, because as we know, antibody levels will fall over time. It's giving it too early, that will fall over time. So that is why it's given round about 28 to 32 weeks. So using that same theory, I think it's very, very helpful and crucial, actually, to protect your baby against COVID. And by that is actually sharing the antibodies that you're making from the COVID vaccine that you received onto baby. So yes.
Thanks. I know, a lot to unpack with that. Thanks so much. That's all the time we have for questions today. I will include answers to any questions that didn't get answered live today in the follow-up email. Thank you so much, Dr. Fong, Natalie, Osler Health, and Mother and Child, and to all of you for joining us today for our expert chat. We hope you all learned some helpful information on pregnancy in Singapore. Look out for a follow-up email with a link to rewatch today's presentation, as well as an opportunity to provide feedback on today's event. Plus, I'll send out a link to Osler Health International and Mother and Child's Guide to Having a Baby in Singapore, as well as some additional resources that you're going to want to check out. Stay tuned for our upcoming events. Our next expert chat will be in January. Thank you so much.
Thanks for having us.
Yeah, thanks.
Thank you.
All the best.